Hello, it's Dr. Amar Romanovic from German Heart Center here in Dubai. Our today's topic is broken heart syndrome. Anyone who has lost a loved one or was abandoned by someone knows the pain of a broken heart. The so-called broken heart syndrome is actually a medical phenomenon that can occur at times of great emotional distress such as grief, heartache, and stress. Here you can find out how you can recognize the broken heart syndrome, what exactly happens in the heart when it breaks, and what to do then. What exactly is broken heart syndrome? Broken heart syndrome, also known in medical circles as Takotsubo Syndrome or Stress Cardiomyopathy, is an underexplored disease. It causes symptoms similar to those of a heart attack, such as heart pain and shortness of breath, but requires very different treatment. The pain is triggered by severe emotional distress. In most cases, exceptional emotional or physical situations are assumed to be the cause. This can be the death of a loved one, but also love sickness or physical stress, such as an operation. Post-menopausal women are particularly affected, but it sometimes happens without a clear trigger. How this syndrome develops and which mechanisms are responsible for it is not yet fully understood. The disease was first described by Japanese doctors in 1990. The so-called Takotsubo Syndrome was named after a traditional Japanese spade trap in the form of a bulging clay jar with a narrow neck. It reminded the doctors of the typical picture of the heart in this disease, a movement disorder and a balloon-like expansion of the left ventricle. How do I know if I have broken heart syndrome? Typical symptoms are severe chest pain, shortness of breath, and at the same time elevated heart enzyme values in the blood and a pathologic ECG. Usually, these signs tend to point to a heart attack during a medical examination. However, around 2% of all patients suspected of having a heart attack suffer from broken heart syndrome, a sudden loss of heart function that can be just as life-threatening as a heart attack. In contrast to a heart attack, no vessel is occluded in broken heart syndrome. In fact, cardiac catheter examinations often reveal inconspicuous coronary arteries. Together with a history of extraordinary emotional or physical stress and the typical picture in the cardiac ultrasound, the diagnosis of a broken heart can be made. How our hearts can break? A heart can't break, of course, but intense emotional stress can be a trigger for the sudden dysfunction of the heart. Scientists have found that brain regions responsible for processing emotions and controlling unconscious bodily functions such as heartbeat and breathing do not communicate as well in patients with Takotsubo syndrome as they do in healthy women. This means that changes in the brain could increase susceptibility to Takotsubo syndrome. Cardiologists and neuroscientists are now trying to research how the heart and brain interact in this disease. What does the treatment look like? The risk of life-threatening complications is particularly high in the early phase of broken heart syndrome. Monitoring in the intensive care unit is therefore indicated in order to detect an imminent shock or serious cardiac arrhythmias at an early stage. Depending on the triggering event, psychological support may also be necessary. Once the acute phase is over, the prognosis is good. The changes in the heart muscle usually resolve completely within a few weeks. There is currently no reliable therapy for stress cardiomyopathy. However, researchers have come to new insights into the disease that could also be relevant for treatment. Accordingly, heart cells from broken heart syndrome patients show increased signal transmission and increased sensitivity to stress hormones, so-called catecholamines. These two mechanisms were identified by the researchers as typical for the broken heart syndrome. Based on these findings, the mode of action of various drugs on the diseased heart cells is to be further researched. Thank you so much for listening. Please help me tell others about this channel by reviewing, rating, subscribing, and please share it on social media. Until next time, stay healthy and happy. Goodbye.